Hello, welcome to the Health In Show, an affiliate program of Homeopathy World Community. You've come to the right place to tune in and participate with your comments and questions. Love is the greatest healer of all, but sometimes, in order to change our emotions, we must take action in other spheres of our lives. We speak with experts in alternative and complementary health fields and hope you will benefit in some small or great way. Remember, you are wherever your thoughts are. Make sure your thoughts are where you want to be.
Welcome, everyone. Today is May 26, 2014. It is Memorial Day, a day when we honor and give dignity and respect to the fallen heroes of war. And we're going to be talking about a miracle drug that has been used since the beginning of time, it seems. And a little note about that, as aspirin, which is the focus of today's show, is a real lifesaver and a pain reliever. Aspirin originally derived from willow bark and has been used. But in 2009, the Army and Air Force Exchange Service removed these products, any products containing aspirin, from the shelves, since the Department of Defense officials ordered that aspirin in combat zones be controlled. So we will probably learn some more about that in the future years, how aspirin will and will not be accepted and used. Basically, if a soldier does go into battle, into combat, and there is a wound, that means that they do not want to bleed out, and that is the reason for the new ruling. Just a little tidbit of news about aspirin, and we're going to start formally with the show now as we learn about aspirin together. On slide number 1, and I want to welcome everybody who's with us today. You can call me at 919-518-9773 if you're in the United States, or via Skype at Computers 2K Voice from anywhere in the world. And I welcome your calls. So global mortality from the 1918-1990 influenza pandemic may have been between 30 to 50 million people. Mortality, they died. The deaths occurred among those who stifled their body's attempts to heal itself by taking allopathic potions, such as aspirin and other inappropriate treatments. And this is the homeopathic point of view. Also, all of the programs on Health In and homeopathy presentation are for educational purposes only. Always see your healthcare provider. We're going to go to slide number 2, and I'm going to check in on the chat from time to time to see if anybody's with me and leaving any comments or questions. A quote from a homeopath, an MD, Frank Newton in Somerville, Massachusetts, states, "There is one drug which directly or indirectly was the cause of the loss of more lives than influenza itself. You all know the drug. It claims to be salicylic acid. Aspirin's history has been printed. Today you know what the sedative action of salicylic acid is." What they mean, I think he means when he says sedative, the relaxation response in the body to the vessels. It did harm in 2 ways. Its indirect action came through the fact that aspirin was taken until prostration resulted and the patient developed pneumonia. And even today, when influenza comes to town, the main reason for death is for the secondary infection, bacterial infection of pneumonia into the lungs. So let's go. What is aspirin? It all began with willow bark. Willow bark's pain-relieving potential has been recognized throughout history. Thousands of years ago, the Chinese, Egyptian healers We're using willow bark to lower fevers, ease inflammation, and reduce pain. So we know those are the three main things. The Greek physician Hippocrates, who was called the father of medicine, lived in 450 BCE to 380 BCE. And during his lifetime, people were advised to chew on the bark, the willow bark, again to relieve pain and reduce fever. Do I have thousands of years ago? Okay, now Hippocrates also told women in labor to chew the willow bark to ease the pain of childbirth. We now know that aspirin actually induces labor, contractions, and affects fluid retention in the body. Willow bark acts a lot like aspirin, so it is used for pain, including headaches, like Goody's powder that we have formulated in North Carolina, muscle pain, menstrual cramps. I know most people in my age probably took that for that. Rheumatoid arthritis, osteoarthritis, gout, and a disease of the spine called ankylosing spondylosis. Now we're going to talk a little bit about the salicylate salts. Sodium salicylate has been used for medical purposes for hundreds of years. It is the salt form of a chemical called salicylic acid. In 1763, this white-colored powder was discovered, and it became the first non-steroidal anti-inflammatory drug, and you're going to hear that a lot. It is an NSAID. It is sometimes recommended to reduce the symptoms of rheumatism, also whooping cough, we're going to learn about that, and kidney disorders. When sodium salicylate is used as a non-steroidal anti-inflammatory drug, it works to reduce pain and inflammation in the body. And a lot that we know about medicine today is that inflammation is what we're saying is the enemy of the body. Inflammation. We want to reduce inflammation. But we're going to have to double think about the meaning and purpose and why the body causes inflammation. Similar to aspirin, its chemical configuration is slightly different. As a result, it is sometimes prescribed to people who are sensitive to aspirin, recommended for people who have inflammation of the kidney or of the bladder. So that's taking it in place of aspirin itself. Willow bark's active ingredient. In 1828, a German pharmacologist isolated the active ingredient in willow bark and called it salicin, later renamed salicylic acid. It is the chemical cousin to aspirin, acetylsalicylic acid. And I want to put a little note in there that at that same time was the era when Dr. Samuel Hahnemann, the father of medicine, was alive and actually practicing medicine. He lived from 1755 to 1843. In 1829, the effective ingredient salicin was successfully isolated from the willow bark, and toward the end of the 19th century, the Bayer company, everybody knows Bayer is synonymous with aspirin. They were located in Germany, trademarked a stable form of acetylsalicylic acid, calling it aspirin. The A for acetyl, the spur from spirea, the salicin that they used came from meadowsweet plant, the Spirea ulmaria, and the in of aspirin is the common ending in drug nomenclature. And I have to show for you the next slide is one of the old advertisements for Bayer used in pre-1904, their company logo, because there was a little bit of controversy about who owned the patent on aspirin. So what they claimed is aspirin was used as an analgesic, a painkiller, an antipyretic to reduce fevers, and an anticoagulant to prevent blood clotting, and is the most commercially successful drug ever discovered. If any drug is taken in excess, this is slide 13, if any drug is taken in excess, which normally can alleviate symptoms, it can actually cause damage and death. And as an example, I have the story of Beethoven, who ingested large amounts of salicin before he died. I believe he had typhoid fever. He had an illness and was reducing his fever and his pain, but his autopsy report is the first recorded case of a particular type of kidney damage that can be caused and traced to salicin. A little bit about the actual amount that you're taking, and throughout this show today, I want to make it clear what is used as a crude drug, as salicin, aspirin, salicylic acid, when you're taking the pills, or if you're taking it homeopathically, the energy of this meadowlark, of the drug from the willow bark, or from the chemical salt. So we're going to make a differentiation of that. This now we're talking about one tablet contains 5 grains of aspirin, and if you look on it, it will say 325 milligrams. Aspirin advertised as aspirin arthritis strength or extra strength contains more aspirin per tablet. That's 500 milligrams. Many common pain and cold remedies also contain aspirin. Therefore, you could easily overdose yourself without even realizing it, because if you're taking aspirin to reduce your fever and your pain in addition to some cold medication, then you could be taking too much, and which could affect your blood clotting ability, your kidneys, your lungs, and so forth. So always read the label. Today, aspirin is recommended for many ailments. In the 20th century, over 1 trillion aspirin have been sold and taken. The first medicine created by techniques of modern chemistry. They were consumed globally to regulate the blood vessel elasticity, to reduce fevers, prevent cardiovascular ailments, and we get recommendations from the medical community about taking it for that, to affect blood clotting, and you learned about the soldiers not wanting their blood clot while if they have a wound, and for ease of inflammation, to reduce pain in many diseases today, for headaches, the common headache, migraines, and for pain relief. But we do have benefits to not having the blood clot. Scientists believe that it is the acetyl addition to salicylic acid that provides the anti-clotting benefits of aspirin. Therefore, you can see that if you're just chewing on the bark of the willow bark to ease your inflammation of arthritis or such, it may not protect you from a heart attack, a stroke, or cancer, which is purported today. And however, the willow bark can be irritating to the digestive tract, just as any aspirin is. Let's take a look at a variety of the benefits of the use of salicylic acid. In crude form, as an aspirin, as a pill, if you crush it or make a paste or a compound, you can take it and you can scour the internet and find all of these different uses. Even Dr. Oz talks about using it as a skin acne treatment. He gives you instructions how to use it as a chemical peel to make glowing skin. You will find that it is in wart removers. You can make a paste of it and put it on your wart. You can put it in a shampoo and put it for your hair, for psoriasis, for dandruff. You can see how if you have dry, itchy, inflamed red skin, that aspirin might give a benefit. You will find that people who shave might get bumps or irritation in the skin. So it's said that you can put some of that onto your skin for ingrown hair. And there are thousands of, 3,500 specifically, around that amount of journal articles about aspirin every year. That tells you how much they're investigating the properties of salicylic acid. And so today they're saying it can be used for breast cancer, ovarian, skin, colorectal cancer, and esophageal cancer, and many other cancers. How it is used in low dose. Also, for people who are having preeclampsia, high blood pressure in pregnancy, they found that it prevents mortality. Of course, the salicylic acid affects the fetus as it is growing. It affects the heart of the fetus and might cause low birth weight, but it could prevent mortality. In addition, it is used for cardiovascular disease to prevent clotting, for people who have bone problems. They ease joint pain, rheumatism, and arthritis, although they have done scientific experiments or clinical trials to find out how it works with the bones and not have come up with anything really solid. It is also used as a fungicide. That's in crude form in the Whitman's oil for ringworm, which tells you it can be used as a fungicide, and also as a vermicide against worms, pinworms specifically. And it's interesting, it's also used in agrohomeopathy for your garden. And lastly, for the lungs, the respiratory tract. And as we know, it does make a difference when you have a flu, that you should not be taking any kind of aspirin. However, clinically in trials with other chemotherapy drugs, the para-amino-salicylic acid is used to alleviate pain and reduce tuberculosis. And that is also another disease today that has antibiotic resistance. So here we have aspirin. A little bit more about aspirin and NSAIDs, the nonsteroidal anti-inflammatory drugs. They reduce the pain from inflammation that is present in most types of arthritis by blocking the body's chemical reactions. They, however, are not steroids like cortisone, so it has a different kind of action. And one of the things that you're going to find out is there's politics to absolutely everything in the world, including drugs. Luckily, aspirin costs less than any other drug on the market and has been the drug of choice. A little note about that, because it's so inexpensive, a lot of people will say, well, let me buy it in quantity. I'll buy a bottle of 1,000 aspirin. And so it can go bad. And remember, I posted a little something on Facebook. Did you ever take an aspirin, put it in your mouth, and you think you're going to swallow it, and it dissolves because it's not enterin coated, it's not coated, and it dissolves in your mouth, and how you gag on that? It's very, very bitter and sour, and it really doesn't taste good at all. And so they do add flavors today. However, if you have a large bottle, smell the bottle and see if it has a sour taste, the sour smell, and that means that it has gone bad. Aspirin reduces pain, but it does not address the chronic condition and the tissue organ degradation that may be occurring in the body. So it may be masking symptoms while you have disease progression. Always use aspirin under a doctor's supervision. I know it's over the counter in America and probably most places in the world. You just pick it up in the pharmacy and you take it. But you need to be sure, because aspirin is used to treat pain and reduce fever and inflammation, but there are times when it should not be taken. Recommendations on using aspirin to treat or prevent heart attack, stroke, and chest pain like angina changes all the time. We just received medical news in the New York Times, in the medical journals, that people who have been taking a daily baby aspirin for years and years and years, it may not be doing anything good for them. It does stop the platelets from clotting. It keeps the blood flowing. So they recommend now only if you have a history of heart attack, stroke, any kind of blood vessel problem, that you do see your doctor and see if they continue to recommend it for you. If you have not had any of those conditions, then it's not going to benefit you. And a lot of people think, oh, I'm just taking it as a preventative, and you may not be doing yourself well. Okay, the next slide is, we're going to learn a little bit about chemistry, how aspirin works. Aspirin, also called paracetamol and other NSAIDs, all act by the same mechanism. They have an inhibitory action on prostaglandin, PG synthesis, and all show varying levels of analgesic, anti-inflammatory, antipyretic, and antiplatelet action. You're hearing that over and over again, just as Bayer claims this is what it does. PG, prostaglandin, is any group of cyclic fatty acids compounds with varying hormone-like effects, notably the promotion of uterine contractions. And remember that the willow bark was used for that. Topically, NSAIDs, medicines like acetaminophen, which is used in place of people who don't do well with aspirin, ibuprofen, they all have analgesic effects. So you might have an ointment that you rub onto the skin and it will numb the skin, and typically it will not be absorbed deeply into the body, so it's not going to cause those hormonal changes in the body as deeply as if you take it orally. However, you still need to be careful because, again, you're numbing the skin and you're masking whatever is going on, but it may relieve your symptom of pain. More about prostaglandins, a group of lipids, so that's fatty acids, made at the sites of tissue damage and infection that are involved in dealing with injury and illness. This is really interesting. They control the processes of inflammation and blood flow and the formation of blood clots and induction of labor. But you see the difference. Unlike most hormones, on the next slide, the prostaglandins are not secreted from a gland like you usually think of the pituitary gland, the thyroid gland, the adrenal gland. They secrete different hormones. The prostaglandins are not secreted from a gland to be carried into the bloodstream and work on specific areas of the body. Rather, they are made by a chemical reaction at the site where they are needed. That means in every cell of your body this could be occurring. They can be made anywhere in any organ. Prostaglandins are part of the body's way of dealing with injury and illness. Therefore, prostaglandins are good. We need them. Aspirin is going to block the prostaglandins because it's trying to block inflammation. However, in homeopathic viewpoint, there's a totality. We need to understand the action on the body and how people are sensitive to different drugs and medicines. When a blood vessel is injured, a prostaglandin called thromboxane stimulates the formation of a blood clot to try to heal the damage. Yes, you want that to happen. You don't want to bleed out. It also causes the muscle in the blood vessel wall to contract, causing the blood vessel to narrow to try to prevent the blood loss. There's another prostaglandin called prostacyclin, which has the opposite effect to thromboxane. Prostacyclin reduces blood clotting. That does the opposite and removes any clots which are no longer needed. It also causes the muscle in the blood vessel wall to relax so that the vessels will dilate. The opposing effects that thromboxane and prostacyclin have on the width of the blood vessels can control the amount of blood flow and regulate the response to injury and inflammation. So I think that is really important to understand the action of aspirin on the endocrine system. And we have lots of chemicals in our environment that act on the endocrine system as well. Prostaglandins are also involved in regulating the contraction and relaxation of the muscles, specifically in the gut, in the digestion, and in the airways, in the lungs and respiration. These are two important places in the body where there's action from the prostaglandins. So that's why we think of taking an aspirin and ending up with a bleeding ulcer, or taking an aspirin when you have influenza and it's going to cause you to go into the pneumonia. Prostaglandins are known to regulate the female reproductive system. I think that I've hammered that into your head pretty well, and are involved in the control of ovulation, the menstrual cycle, and the induction of labor. Indeed, manufactured forms of prostaglandins, those are prostaglandin E2 and F2, can be used to induce labor. Now, what about drug interactions? Do not use aspirin if you have a bleeding disorder such as hemophilia, recent history of stomach or intestinal bleeding. That's just common sense. Do not use aspirin if you are allergic to an NSAID, a nonsteroidal anti-inflammatory drug. There are a huge long list of them: Advil, Motrin, Aleve, Indocin, and on. So read the labels. And do not take aspirin with other blood thinners like warfarin and Coumadin, which are very commonly prescribed. More drug warnings: do not give this medication to a child or a teenager who has flu fever or flu symptoms, or the chicken pox, which is the herpes simplex virus. Salicylates can cause Ray's syndrome, a serious and sometimes fatal condition in children, and affecting those recovering from chickenpox or a viral illness. So specifically, I'm kind of seeing something happening with a viral illness and the use of aspirin as opposed to a bacterial illness and infection. So there's two different modes of action. I think there must have some research into that. Aspirin may be harmful, again, to the unborn baby's heart, and may reduce the birth weight and other dangerous effects. Obviously, it's affecting the formation of the blood vessels, the relaxation and contraction, and all of the menstrual cycle and the female reproduction. A few more warnings. Aspirin can pass into breast milk and may harm the nursing baby, so don't take it while breastfeeding. Also, other interactions are aspirin with alcohol, or coffee, or other beverages that contain caffeine, tea, cocoa, and soft drinks. Alcohol and caffeine make the stomach more sensitive to irritation. So don't take your aspirin with a drink of caffeinated beverage. Excedrin, this is really fascinating to me. They make Excedrin. It's a combination of acetaminophen, which is Tylenol, which can be really harmful to the kidney, acetylsalicylic acid, which is aspirin, and then they put the caffeine right in there with it. So somebody give me something into my logical thinking. I guess it really boosts it and makes it work better. Or maybe you just have to go to sleep after taking it. Do we have comments? I haven't been checking in on there. Dr. Bob says prostaglandin is like the opposite hormone of adrenaline. Oh, and I welcome Ignacio for joining us today, and Pam and Mid, whoever you are. Thanks, Dr. Bruck. Aspirin side effects. Okay, if you're taking aspirin and you feel that burning in your throat and your upper chest, that's heartburn. Other kinds of irritations to the stomach lining, indigestion, pain, nausea, even to vomiting and bleeding ulcers. If you have any ulcers or bleeding, you're going to see black, tarry stools. That's dried blood in your stool. A few people sensitive people will have a allergic reaction to aspirin, and they will induce, and people are very sensitive. If you're asthmatic, you might get hay fever or nasal congestion or hives, which are urticaria. We're going to hear more about that. The skin obviously is going to bruise more easily, so if you bump up against something, because it's keeping the blood flowing and not clotting, also it's going to cause fluid retention in the kidneys. And as a less common side effect, there's difficulty breathing, swelling of the face, lips, tongue, or throat, and rapid breathing. And in the mind, there will be confusion, hallucinations, seizures, and convulsions. That's if you go in and read deeply in drugs.com and find out all the side effects. So this is the basic thing. Aspirin should not be taken 10 to 14 days before surgery, including dental or oral surgery, to avoid excessive bleeding during or after the operation. And I usually tell you the importance of dental hygiene and dental health, that if you have bleeding gums or infection in your gums, it means that also your heart can be affected. It's a very close relationship. And if that is true, and we know the relationship of aspirin to your heart and your blood, then you have to be really careful. Okay. Caffeine causes faster absorption from dilating the blood vessels, and that is the explanation from Dr. Bob of why Excedrin has this combination in there. So I guess if you really want your aspirin to work quickly, it's going to do that. Ignacio, hello. Are you in Brazil or Mexico? I don't remember where you're from. He says that he knows caffeine increases the rate of absorption of acetylsalicylic acid. Yes, that's true. Many analgesics must be avoided after dental surgery. Okay, great. So he's telling us that not only before surgery, after surgery, because after surgery you do want your, in many cases, you want your blood to clot. So like if you're having a tooth pulled, you need to have the clot formation, otherwise you're going to get the inflammation in the root socket and have extreme pain, and it's not going to heal properly. Okay, I'm throwing in the differentiation here between how aspirin is used allopathically in the medical community for specific parts of the body, for specific actions, and how a homeopath looks at the totality of symptoms, that all drugs have effects that must be monitored in sensitive individuals. And when homeopathic provings of medicines, plant minerals on animals are done, we often use a person who is sensitive so that they can elicit all of the different symptoms, and we know the totality of actions, all the things that it does in the body. Hahnemann, the father of homeopathy, says all the signs and symptoms presented by the patient from the former healthy state to the changed disease state are considered for the remedy selection. That means that when you have a patient or a client coming in for a homeopathic consultation, you get the history of the person and understand what did they look like when they were healthy. And then what changed in them to the disordered state, the change in their energy state. Individual of drugs and adjusting the dose is done both in allopathic medicine and in homeopathic medicine in perhaps little different ways. So you always want to talk to your physician, your doctor, and your doctor must keep in touch with you to learn what is the correct dosage because of the overdose toxicity that might be present in a sensitive person. And what they can do is they can take a blood level check and see how much salicin you have in your blood. And another thing that they will do, let's say you have a chronic condition. You have rheumatoid arthritis or you have the spondylosis, and you're on daily doses of aspirin. In those cases, you're usually instructed to take the aspirin at certain times of day, maybe more often at night. Well, you don't want to take it and lie down because of the problem with your stomach. You also probably will be taking it as an enteric-coated aspirin, meaning that it's going to go into the body and have a barrier so that it's not causing so much irritation to the stomach lining. And they also have aspirin in slow dissolve. So over a long period of time, it's slowly working. But you want to be taking it, the doctor will tell you to take it every day, not only when there is pain, in order to maintain the blood level to control swelling, pain, and stiffness. So basically, it's maintaining control over the body's functions. It's not working homeopathically to elicit the body's own healing response. Remember also that different brands of aspirin contain different amounts of the drug, and some people, different brands work better or worse for them. In the next slide, we have Dr. Samuel Hahnemann tell us that we use the minimum dose in homeopathy. The suitableness of a medicine for any given case of disease does not depend on its accurate homeopathic selection alone, but likewise on the proper size or the rather smallness of the dose. And we know that in homeopathy, the remedies, whether it is aspirin, salicylic acid, natrum salicylic, whatever, salicylate, and all the other homeopathic remedies are diluted and succussed. They're shaken and potentized to get the dynamic energy from the substance into the dilution. So it causes the least amount of side effects. Actually, no side effects. They're all effects. And so you understand what the drug is doing in the body and how to use it appropriately. Also, in homeopathic speak, we have something called the simillimum. What a medicine causes can be used homeopathically to cure. As an example, remember Beethoven. The salicin from the aspirin causes kidney disease and fluid retention. Therefore, in such cases with similar symptoms, the remedy may affect a healing response. So any kind of homeopathic remedy that in a proving or a clinical state will cause a certain symptom might be the correct matching remedy to heal that symptom. I want to make that clear so we're not mixing it up. Ignacio, yay, you are from Mexico. And he's giving us a hint that his wife is a dental surgeon. She uses arnica and belladonna alternatively for after tooth extraction. That's a good bit of information. Thank you so much. The salicylate, sensitivity and intolerance of food sensitivities. So I'm putting this up on slide 35 because we've been talking about individualization of medicines and remedies, the appropriate dosage, the appropriate amount that should be in the body and given to the person. And homeopathically, we take a full case and we find out what are the sensitivities. We ask what foods aggravate you, what foods make you feel better. And in these cases, we might find out a lot about foods that actually contain the salicylates. So if you find out in the case taking that there's sensitivity to food, to the salicylate intolerance, and this is something, let's continue on slide 36, that foods that contain aspirin-like compounds, grapes, almonds, cherries, apricots, and wine, all of those delicious foods contain aspirin-like compounds. The caffeine can exacerbate the salicylate response in a significant portion of people with tinnitus, with ringing in the ears. So people who have this problem, tinnitus or Meniere's disease, who eat grapes, almonds, cherries, chocolates, they might find that their ringing in their ears are worsened. Do you have a...
When you say aspirin-like compounds,
Yes.
do they stop pain or do they thin the blood and
Exactly.
Everything?
Everything.
So
These
it's just like aspirin.
just like the mode of action of aspirin. We know that we talk about resveratrol from wine, from the skin of the grapes. They're good for the heart and for the blood. We always eat almonds. It's good. Cherries are for gout. People who eat the black cherries, we know it alleviates inflammation and the uric acid in the body. Apricots, all of these different things. So we can see our foods are medicine. Did you have a comment?
So were the studies made to see how many, like, can you take half a cup of cherries or half
Yeah.
a cup of almonds a day instead of a baby aspirin or something.
That's
something like that.
That's a good idea, but do you think that the medical world is going to tell you, don't buy our drug, let's just tell you to use food? And
I'm not asking
okay.
the medical.
Okay, so,
No, I'm saying-
but definitely, you make the decision, you become educated, and you learn that it's really good, like to have walnuts and almonds and cherries, and these are good for you. And you might not realize why, but this is why.
Right, but the question that I have is
Yeah.
whether any studies made.
Yeah.
I mean, obviously you can eat a bunch of walnuts, a bunch of cherries, and now you're overdosing.
No, you're not
Well,
overdosing.
you see, that's what I mean. Is where
You're not overdosing because you're eating a whole food and it
Okay.
has a different mode of action. It's not a crude drug that's going to force your body to do this chemical change.
Okay.
Your body will use it as it needs it. Okay, caffeinated foods like soda, green tea, black tea, as well as chocolate will have these same kind of salicylate sensitivities. Also, there's a phenomenal list of salicylate foods, and if you research the Feingold diet, you're going to find all the list of foods that have it. Dr. Hahnemann says in the Organon of Medicine in aphorism number 4, he, meaning the physician, is likewise a preserver of health if he knows the things that derange health and cause disease, and how to remove them from persons in health. So make sure that you understand a little bit. You could be your own physician. If you're eating something every day that's causing you pain, heartburn, indigestion, then you know you're having a sensitivity. The Organon of Medicine in aphorism number 94 also states, while inquiring into the state of chronic disease, that's like the rheumatoid, it's not an acute injury, a chronic disease, the particular circumstances of the patient with regard to his ordinary occupation. So we really take a full case and learn what the patient, the client does in their lifetime, what they're in contact with in their environment, his usual mode of living and his diet, his domestic situation, which means the relationships he has, the stresses that he has. He must be well considered and scrutinized to ascertain what there is in them that may tend to produce or maintain disease, in order that by their removal the recovery may be prompted. Therefore, what we're talking about, what Hahnemann is telling us is, if there's an environmental cause, if there's something in a person's life that's causing chronic disease, become an observant, an aware observer, and just see if that's all that needs to cure the person. You don't have to give a drug. You can just change the lifestyle or the diet or whatever's happening in there. If you're living in a moldy house, you're not going to feel good, right? Okay. The use of salicylic acid, aspirin-like compounds. This is what we've done so far. We've learned about salicylic acid. We're now going to learn about a little bit about the materia medica, and we learned about how homeopathy works. Like cures likes. We have to match the symptoms of the patient to a homeopathic remedy that will, or a medicine that will cause those same symptoms. For instance, if aspirin causes stomach ulcer, a homeopathic formulation of the aspirin will or may cure if there's a totality of symptoms. Now we're going straight into the materia medica from Boricky, and that he is a homeopath. He says the natural history of salicylic acid has some general symptoms that point to the use in rheumatism, dyspepsia, and Meniere's disease, the tinnitus and ringing in the ear, prostration after influenza, and also tinnitus aurium and deafness, and also hematuria or blood in the urine. Now we look here at ringing in the ears, tinnitus as a side effect of aspirin. Okay, aspirin causes ringing in the ears. You might be taking an overdose of aspirin. So high doses of salicylate may cause ringing in the ears and slight deafness. Therefore, homeopathically, salicylate is maybe your cure. The repertory, the list of different symptoms by Bowricke, lists Meniere's disease. You can see if you look up vertigo, dizziness, labyrinth origin, there's 25 remedies listed in that rubric in the repertory, and one of them happens to be salicylic acid. There again, it confirms the concept that it would be good for tinnitus or vertigo. In addition, there's 2 compounds, Chinium salicylicum and Natrum salicylicum. Also, in the Materia Medica, we have roaring and ringing in the ears, deafness with vertigo, another confirmatory reason that you might choose that remedy. In the head, symptoms, and so in the repertory, in the Materia Medica, we are looking at the different parts of the body as it's listed and the uses of a drug, a substance, a mineral, an animal, whatever it is, homeopathically to find out their uses. And so we see vertigo. Specifically, this is quite interesting, there's a tendency to fall to the left. So when you get dizzy and you fall to the left, you might be looking at salicylic acid. And many of the homeopaths have said this has really been proven true. Then, everybody takes an aspirin for headache. Well, here it is, listed in the Materia Medica, confusion in the head on rising suddenly. And when you rise suddenly, you get that dizziness, that vertigo, and that you think, oh, there's something wrong in my ear. And then you also have piercing pain in the temples. And so now I'm going to start to be thinking of salicylic acid. What about the nose? Remember we talked about overdose or sensitive people getting hay fever, coryza. Incipient coryza is the catarrhal inflammation in the mucous membrane in the nose, especially caused by cold or hay fever. There we go. It's in the Materia Medica. Likes cures likes. Now what about the eyes? We have retinal hemorrhage. Remember, the aspirin keeps the blood flowing. It won't clot. So we've got a hemorrhage even in the eyes, retinitis after influenza. So now we have a combination of lungs, respiration, eyes. And here we have listed in the Materia Medica kidneys, albumin-uric, which is protein in the urine among patients with type 2 diabetes mellitus that shows kidney damage. So here in the proving symptoms, in the Materia Medica, for homeopathic remedy, it's used for kidney disease. And remember Beethoven, remember his music, what happened to him for fever. Now we're looking at the throat. Sore, red, and swollen. Pharyngitis, difficulty swallowing. These are probably part of symptoms of cold, respiration, or even sensitivity to the salicylate, to the aspirin, to the drug, that people who have reactions, allergic reactions, might have this kind of symptom. Now, there's something I found quite interesting, that salicylate acid is used in whooping cough. One of the more unique homeopathic uses for sodium salicylate, which is natrum salicylate, it's used in the treatment of whooping cough. Some practitioners claim that a few grains of the remedy may relieve the symptoms of this disorder. They believe that its anti-inflammatory properties can help to open and relax the inflamed breathing passages to reduce the coughing associated with whooping cough. And if you've ever seen a child, a baby with whooping cough, you know the paroxysmal coughs and what that looks like and how they're gagging and unable to breathe. Now we look at the mouth in the Materia Medica for homeopathic remedy. Canker sores. What are canker sores? They're ulcers in the mouth. We know that Aspirin causes bleeding and ulcers in the stomach. So look at this. The Materia Medica says it's maybe possibly used for canker sores with burning soreness and fetid breath. In the stomach, we're going to have a lot of symptoms. Flatulence, hot, sour belching, putrid fermentation, fermentative dyspepsia, indigestion, mild discomfort in the upper belly and abdomen. And this occurs, they say specifically, during or right after eating. What about the continuation after the stomach? And now you're going through the intestines and down to the stools. You're going to see putrid diarrhea, gastrointestinal derangements, especially in children. And he gives a description of what the stool is going to look like, comparing it to magnesium carbonicum. And also pruritus ani. This is irritation of the skin at the exit of the rectum called the anus, causing the desire to scratch. And here I think, children who have pinworms, they have irritation of the anus and desire to scratch. Is there a reason for that? Do we understand that all of these parts of the body, every single thing, this is the totality of symptoms? A homeopathic remedy does not mean that you have to have all of these symptoms, but if you have some of them that lead you to realize, yes, vertigo, tinnitus, ringing in the ears, falling to the left, itching, irritation, ulcers, we see that this might be the remedy of choice. Now, aspirin is mostly used for rheumatoid arthritis and chronic joint pain. What do we find in the Materia Medica? That listed under the category of extremities, knees are swollen and painful, acute articular rheumatism, worse for touch and motion, with profuse sweat. And this is kind of interesting because I've never read anything allopathically about sweat, but in the Materia Medica, it is listed. It says that the pains shift, which you might be thinking about something like pulsatilla, sciatica, burning pain, worse at night, copious foot sweats, and ill effects where sweating is suppressed. So homeopathically, you'd have to do a differentiation between other remedies that have similar attributes, similar symptoms dealing with sweat and reducing sweat, perspiration. Okay, in the chat, a couple of notes. Thank you so much for participating, Ignacio. We really appreciate this. He's telling us that grape toxicity for kidneys in dogs, because Ignacio is a veterinarian, a homeopathic vet, and so he sees a relationship here of why many dogs may not be. Don't pop those grapes into the dog's mouth because it's not going to be good. They're also very sensitive to chocolate. Now, isn't that interesting? Now we are understanding a little bit more about foods as medicine, as drugs. Ignacio also says that my dog catches anything thrown into him. He did once throw him grapes and watched it fall. He didn't even, the dog ignored it. Oh, so he threw him a grape and the dog totally ignored it. Okay, good. Smart dog. Dr. Bob says he just used his mouthwash called Listerine, and the active ingredient is methyl salicylate to kill bacteria. That's interesting, isn't it? So if an aspirin followed by a homeopathic salicylate, will the homeopathic drug cancel the effects of aspirin? Or might it just cancel the negative symptoms? That's an excellent question. So, Manfred Mueller, who is a homeopath here in California and also in North Carolina, has his own protocol where he finds out all of the different things in a person's life that they have been sensitive to and will give him almost like a homeoprophylaxis. He'll say, if you have been sensitive to any drug, he'll give it to you in homeopathic form, kind of like an isopathic remedy to negate the negative effects. So yes, that's exactly what he's saying, and that's exactly what Hahnemann said, that if a person is taking a daily aspirin and they're now getting all of these side effects, then homeopathically you want to stop the person from taking the drug because it's causing, they're getting an overdose and the body's not handling it well, and you want to alleviate the symptoms with the body's own immune system. And in homeopathy, we have a primary effect, which is the drug effect, which is everybody can observe. And then there's the secondary effect, which is very minute energy that is coming from the body that will allow the body to heal itself. And so let's go to the next part of the body. I hope that answered your question. In Boericke's Materia Medica, again, he has skin symptoms listed: itching vesicles and pustules, better by scratching. Didn't we just learn that people allergic to salicylates and aspirin have hives? So here we go. Sweat without sleep, urticaria, which is the scratching, itching, hives, or skin rash or bumps. And remember, the paste is used for people who have sensitivity. Hot and burning skin. Purpura, which means purple, is the appearance of red or purple discolorations on the skin that do not blanch on applying pressure. So we know that if you have edema, retention of fluid, then your skin will have this kind of, you apply pressure and it's not going to blanch like a normal person would because it's filled with fluid. And lastly, he puts here on this particular slide, herpes zoster. Herpes zoster is chickenpox. And what do we tell you? Don't take aspirin if your child has the chickenpox. Isn't this amazing how it all makes sense? Do you want me to say something? What? The last thing. Thank you, Dr. Bob. Appreciate it. Well, I'm studying like a banshee. Okay. The next little tiny slide says, this is listed in the Materia Medica. Necrosis and softening of the bone. Don't we take aspirin for osteoporosis? And I did do some research in the PubMed, in the medical journals, that they said that they were doing medical trials for people to take low-dose aspirin to see it did cause a very slight increase in bone density, but it had no effect at all on reducing risk to fractures. And this is something that we think of in osteoporosis. So it really wasn't helpful, even though it might cause like a 1 to 2% increase in bone density. We have diabetes mellitus. This is an epidemic disease. We've done many shows about this, and there is the Reverse Diabetes Summit, a lot to do with what to eat, changing your diet. Homeopathically, these are a bunch of homeopathic remedies that are listed for diabetic nephropathy. Look what you find. Salicylic acid. It is listed, just to make note of that. And then at the end of the chapter in the Materia Medica for each remedy, we have a way to compare the relationships between one remedy to other remedies that have similar action in maybe different parts of the body. So it's written to compare salicylic acid with Salol. And Salol is a highly diluted homeopathic phenyl salicylic. It can be created in the lab with salicylic acid with phenol when you heat it up and create a brand new compound. So he says, take a look at this other remedy. It's good for rheumatic pain in the joints with soreness and stiffness, headache over the eyes. For urine with violet-smelling urine, so it smells like the flower, we have remedies called colchicum, which is the #1 remedy for gout.
Why can't you just bottle it instantly?
You can.
It smells so good.
Yeah. Bottle your urine?
with a smell of.
Oh, well, absolutely. Do you know, what do you think all cologne is made from? Urine.
Oh, come on.
Yes. Okay, so now we have China officinalis, which is an influenza remedy. We have lactic acid. And then we have spirea. Remember the meadow sweet plant, which is willow? He tells you compare spirea, and also there's another remedy which I just learned about, Gaultheria, which also contains salicylic acid. And I've been doing a bunch of reading that says that this Gaultheria is really a wonderful homeopathic remedy in influenza. So, this is a review. Dr. Bob says after you give a lesson, a lecture, you want to review. What did we learn today? We learned the history of willow bark and salicylic acid. It's an allopathic miracle drug. It's used everywhere. There's trillions of doses taken. It's been used since ancient history, from back in the Egyptians and the Greeks and on till today. However, we do have side effects and warnings and drug interactions. If you have gout and you're taking a colchicum, do you take aspirin with it? You better be careful. If you are taking Coumadin as a blood thinner, you better be careful not to be also overdosing yourself. We learned how it works in the endocrine system with the prostaglandins. And I didn't even go into the COX. That's another aspect of how it works. We learned that it's an analgesic. It's used to reduce inflammation. In fact, it is used for chemotherapy in all different kinds of cancers. Homeopathically, we learned about the clinical effects, the proving effects. We learned that we must take into account the principles of Hahnemann that taught us the organon of medicine, that the simillimum principle, likes cures likes. If you're selecting a remedy, see that it is carrying through all the tissues and organs of the body, that it makes sense in the mental capacity. Is the mind the same, the emotion the same? All of those different parts are the totality of the case. And then we also want to look at the minimum dose. What is the minimum dose to use as a catalyst for the body to heal itself? And homeopathically, that's what it is. The body is healing itself. That's it. I hope you enjoyed today's show. It was really, really... Dr. Bob says perfume is made from horses' urine and sweat. Okay, I can tell you, I worked hard on this show today. I could probably go another couple of hours with the amount of information that is out there. Like I said, there are 3,500 publications annually about aspirin, just in the allopathic world. Next week, get ready. Jenny French is an incredible homeopath in New York, and she's going to teach us about summer remedies. I'm going to need to learn a little something because this is the second time.
It's not next week.
Oh,
the third. No, you're right. I'm sorry.
We're going to be in June next week. Already I have my second case of poison ivy this summer. I don't know how I get it. I must be very sensitive, but it's not too bad. I managed to get through it. And then following, we're going to have Dr. Bruck talking about glyphosate and kidney disease, unless he wants to talk more about aspirin. Following that, I'm going to be on vacation. So enjoy yourself. Go for a walk and get in touch with nature. Then June 23rd, Neera Andaharia from Pennsylvania. She's a yoga teacher and homeopath, an unbelievable, wonderful woman. She's going to talk about yoga, how it complements your homeopathic practice, both for you as a practitioner, a healthcare provider, and for your clients. July 7th, the phenomenal Saurav Aurora, who has an incredible website all about evidence-based clinical cases in homeopathy. He's going to talk to us. And then July 14th, Carolyn Vessel, who is the inventor of sufficiency, and you can go somewhere on the website and see here on Nissan Communications, we have a link to the vitamin C, the sufficiency, and that drink. She says that it really helps with your cholesterol. But there's a lot more in it than just vitamin C. It's all organic. Finally, you can interact with Homeopathy World community by sharing, tweeting, Facebooking, all those wonderful things. And we have a web on Wednesday on Blog Talk Radio. We've been doing Blog Talk Radio for 4 years. I have not been keeping up with it as I had in the past as an everyday thing. But Alan Phillips is there on Wednesday at 6 p.m. talking about vaccinations and your rights. And I do a show on the last Wednesday of each month, which means, is it coming up? Or did I just do it? Last Wednesday. That must be this Wednesday? I am doing a show? Well, I'll figure it out. This Wednesday. Who knows what I'm going to talk about? Whatever tickles my fancy. So I can, unless you have a request. If you have a request, I would love to address it. Please visit nissancommunications.com. There are all the archives. Click the archive button. You can get it either as an audio download or as a video download. Also, we've got them on the Homeopathy World Community Group, the Health In Forum, where I provide for you a lot of background and additional information about each of our guests and each of our show topics. So there's a wealth of information. I want to wish everyone a peaceful day, honoring those who have fallen in war. May there be no more war. That is my motto. May we find a way to see the best in each person. I wish I had a beautiful quote for you today, but love is the answer, and let's make this a world of peace and love. Thank you so much. And there's no other shows today?
Tanya, tonight.
Tonight there will be a show on Nissan Communication at 7 o'clock Eastern Time. Wonderful kudos to Amnon, keeping us smiling here. Okay, thank you, Dr. Bob, Ignacio, Maja, and all those who are listening today. Bye-bye.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Health In with Debbie Bruck, Breaking Free with Marilyn Shannon, Lessons of Vietnam with NCVVI members, The Tanya Love Show, Reawaken Your Brilliance with Julie Seibert, and if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by Atomus.com, makers of quality video recorders and converters for professionals. That VidBlasterGuy.com, CarolinaApparel.com, and DeltaForce.net.